question us is, hypo or hyperkalemia will hurt your patient's cardiac function. So come closer, let's discuss treatments for hypokalemia. Now, that is low potassium. Remember, normal potassium range is 3.5 to 5, right? And anything lower than 3.5, hypokalemia, will put your patient at risk of cardiac arrhythmia. Remember, with potassium, cardiac function monitoring takes priority because hypo or hyperkalemia will cause cardiac arrhythmia or dysrhythmia. Now let's go into the treatment. The first treatment for hypokalemia is potassium replacement. Now, oral potassium, that is potassium chloride, can be given as liquid or tablet, okay? And remember to give this with food to prevent GI upset. And the next one is IV potassium. This is given to patients with level of potassium less than 3.5 or patients that are showing signs and symptoms of hypokalemia. Remember, NCLEX warning, never push IV potassium. It is given slowly and must be diluted, okay? And the next intervention is to monitor cardiac function. Continuous ECG monitoring if potassium is less than 3.0 or if they are on IV potassium, and watch out for flat T waves, U waves, and arrhythmias. And the next intervention is to stop the cause of hypokalemia. You have to know and stop what is causing the hypokalemia. Now, if they are on diuretics, like potassium wasting diuretics like furosemide, and that is what is causing hypokalemia for them, you have to report that to the healthcare provider or the doctor, right? And you have to treat vomiting or diarrhea because they are losing potassium also when they are vomiting and diarrhea, through vomiting and diarrhea. So if they are experiencing GI upset like vomiting and diarrhea, you have to treat the cause. And also, if they are on insulin and albuterol, remember, insulin shifts potassium into the cell, right? So it can cause hypokalemia. So if they are on insulin, and also albuterol can also cause hypokalemia, so you have to monitor their potassium level. And the last one is to educate patients on potassium rich food. Encourage them to take more potassium rich food. Potassium rich foods like bananas, like green leafy veggies, like spinach, like oranges, avocados, and beans. Remember to always check creatine and BUN level before giving potassium, okay? And never crush potassium tablets. Remember to always check the potassium level after intervention, after potassium replacement. And lastly, hold potassium and report to the healthcare provider or the doctor if urine is less than 30 ml or less than 30 ml in an hour, because this is suggesting kidney distress. Okay guys, bye.